Hello, everybody. I know I've lost track of my time, too. I had to pause there for a second. I am so excited that you guys are here. Thank goodness the weather wasn't too bad. Braving the weather outside. I know it's a little chilly, but we are super excited that you came out tonight. We just really want to make this an informational event. LPSS has 2 group health insurance plans. One is Blue Cross, the other is Humana. So it's an informational event for you tonight. That way we can just tell you what plan is available to you. So we've got, I am Trish LaBeouf. I forgot to mention that. I'm the supervisor of insurance here at LPSS. I'm trying to bring staff in the door so I can go ahead and introduce them. I see them coming through. So over here to the left, I have Miss Shannon Richard. I've got Miss Tamara behind you, Tamara Reeves, Miss Sandra LeBlanc, and I'm sure you guys recognize Miss Ashley Wright in her voice that comes across on your messages that we've been sending out through the J-Call system. So thank you for coming tonight. I just wanted to put a couple disclaimers out there. Because it is a health event, please don't disclose your HIPAA information, your personal information tonight. If you've got questions, we want to connect you with a Humana concierge if you've got some specific questions with regard to your health insurance or perhaps your prescriptions. I'm thinking those are where your questions are going to come from. So we can get your name, point of contact information, email, however you want to connect with a concierge. We also have a Humana table outside that you saw when you came in that could probably answer some of your questions, but just keep in mind, keep your health insurance information to yourself, and we'll make sure that we connect you with somebody who can help you in the long run to answer those questions. I'm going to introduce Miss Erin Day. She is, I'm going to get her title correct, the Senior Account Manager at Humana. She has dealt with LPSS retirees for quite a long time. She knows you guys. She can answer your questions. She can tell you the ins and outs of the Humana plan, and she can point you in the right direction. That way you get your questions answered. She's got a short presentation, probably a good 30 minutes for you. She's going to talk through the health insurance information and the prescription with regard to the Humana plan. And then we also have a LPSS retiree here this evening that's going to tell you about his personal experience on the Humana plan. That way you hear it from Humana themselves, in addition to Mr. Roger O'Brien. So I will turn it over to Miss Erin, and we'll get started on the Humana presentation that she has for you.
Thank you, Trish. Good evening, everyone. Appreciate you coming out, just like Trish said, in this weather. Y'all are sports. So I'm going to try to make this worth your travel out here today. Just want to relay some information about the Humana plan that's available through the school board office. The plan that is offered through the school board office is a different plan than what you might hear about of a Humana individual Medicare plan. So it's good to know the difference. We do not offer this type of a rich plan on our individual policies. So without further ado, I'm just going to get started here. Oops. Once I figure out this. No, I keep doing, I don't know what I'm doing. Thank you.
I would say
Scroll.
Yep.
Got it. I know how to scroll now, so we're set. So I'm going to talk just to let everybody know this plan, in order to be on the Humana Medicare plan, you have to have Medicare Part A and B. So I'm going to talk a little bit about Medicare and the difference between having straight Medicare versus having a Medicare Advantage plan. I'm going to go into the details of the Lafayette School Board plan, talk very briefly because it's very easy for you all to enroll, then what to expect after you enroll, should any of you be interested in joining, and go into a little bit about the extra benefits and services that are offered on this plan at no extra charge. It's one of those differentiators by having a Medicare Advantage plan versus having a plan that's like a Medicare secondary plan. There are some bells and whistles there. So at our Humana table, we have our informational booklet that you all can feel free to pick up a copy of. For anybody that is interested in signing up, at whatever point in time, there is an application on the last page of the book that's a tear-out, perforated page. But you don't have to pick that up in order to sign up, because we can always mail you a booklet later on too. So whatever you feel most comfortable with, but thanks for coming out and listening. So Medicare itself, like I mentioned, you have to have a Medicare Parts A and B in order to be on the Humana plan. Once you become Medicare eligible, you will, more than likely, all of you probably have to pay a Medicare Part B premium. You've got to continue paying that Medicare Part B premium even when you're on a Medicare Advantage plan. So please know that we are working on behalf of Medicare when we are processing a claim. So you've got to have that Medicare Part A and B. Our plan also, through the school board office, offers a prescription drug plan, and so our plan is called a Medicare Part C plan, which also includes Medicare Part D, which is the drug portion of the plan. So it encompasses everything all in that one plan. Trish, maybe I do need you to steer. Yeah.
This packet is also in each one of the little folders that you guys picked up when you walked through the door. So if you cannot see the screens, it's in your packet.
Oh, so the presentation is in there. Great. So, like I said, this is a Medicare Part C plan that also includes Part D. And just a couple of items about this Medicare plan option. It's called a PPO plan. And this is a big differentiator between the plan offered through LPSS versus our individual Medicare Advantage policies, in that this PPO plan, you kind of don't need to be worried as much about whether or not your doctor is in or contracted in the Humana plan, because this plan of coverage actually covers at the same rate, 100% coverage, whether you go to a Humana provider or a non-Humana provider. So if the provider that you're interested in going to is not contracted with Humana, as long as they are a provider that accepts Medicare and they're willing to send that bill to Humana, then the claim is going to be covered just as if you went to a Humana network provider. Another item on this plan of coverage that I want to point out to you all is, and it's an extra benefit because Medicare, of course, does not cover services outside of the United States. But we do have an added benefit included in the plan that offers worldwide coverage for emergencies. We will reimburse you up to $25,000 for an emergency should you have one outside of the U.S. When I say reimburse you, yeah, you do need to pay the claim first, because, of course, the United States is the only country or one of the only countries that actually utilizes health insurance. Everybody else is pretty much on a government-run type plan. So if you had an emergency outside of the U.S., you've got to pay the cost. You send that claim to Humana, and we will reimburse you at 100% up to $25,000 per emergency. This plan is a very easy plan to describe, because if you're looking at your presentation in your packet, or if you can see the screen up there, this plan is a 100% coverage plan. So when I'll remind you, you've got to have your Medicare Part A and Medicare Part B. But when you go for services at a doctor's office, hospital, any medical provider, you would present your Humana ID card, and the entire claim is processed at Humana, and it's going to be covered at 100%. There's no deductible that you need to meet. There's no maximum out of pocket that is, stopping anything, because it's 100% coverage, unlimited coverage for your services, for the services that you receive, I mean. So, as I mentioned, Medicare Part D is the prescription drug portion of the plan. And for the prescription drug portion of the plan, you all do have copays that you need to pay. We've got, and I believe it's set up very similar copay structure to the Blue Cross plan that you all are on. So you're probably used to Tier 1 would be your generic medications, the preferred generics. If you're getting a 30-day supply at the pharmacy, you would pay a $10 copay. We also offer a 90-day mail order through, it's Humana's pharmacy. It's now called, we renamed it last year, it's called Centerwell. It's a $20 copay, so you get a 90-day supply through mail order at a 60-day cost. So you only pay 2 copays if you utilize mail order for your medications. Very convenient for anyone that is taking any maintenance medication to have it mailed to your home. I do know that some people don't feel comfortable with having the medications mailed to their home, and just I like to educate people that another alternative to that is if you want to take advantage of the mail order and getting that price cut, you can have your medications mailed to your doctor's office and pick the prescriptions up from the doctor's office there. So Tier 2 is our preferred brand name drugs. Now here is where things could be different on if you're not on the Humana plan currently, and you're on the Blue Cross plan. Different drugs may fall under different tier levels. So, it's not always the drug ABC on every carrier's plan will always be on Tier 1 on every plan. So it does behoove you, if you are interested in possibly moving to the Humana plan, we have in the booklet the most utilized medications that our members use, but it is not an all-encompassing list. We do have a comprehensive list on humana.com, but also what Trish was talking about, if you're interested in having your questions answered and you'd like a Humana representative to look up your medications for you and let you know what tier level it falls under, we're more than happy to do that and answer any other questions that you have remaining after this evening's meeting. Tier 3 is non-preferred medications. You'd pay a $60 copay at a retail pharmacy for that. A 90-day mail order supply would be $120. And then Tier 4 is the most expensive medications. They're called specialty medications, and I'm sure you all have heard about them on the news they've really popped up over the past 10 years. Some drugs are $100,000 a pill. It's just insane. So for those, you pay 10% of the cost. But let me tell you, this is what also makes the school board's plan here richer than pretty much every other plan that I work with other employer groups. If you should need, and hopefully you won't ever need, but if you should need to take a specialty medication, the maximum out-of-pocket that you will pay in any calendar year is going to be $2,500. So for those expensive medications, at least there's a stopgap for you. And after the $2,500 that you would have to pay out of pocket, then those medications are covered at 100% by Humana for the remainder of the year. This is simply another way of looking at the tier levels that I just described. I don't know who made up how we name medications. Are people a lot smarter than me? And if I try to pronounce these, I know I'm going to get them wrong. But I know that level 1, the tier 1 medications, it just gives you an example of the kind of tier 1 medications. You know, levothyroxine and simvastatin, almost everybody I talk to is on both of those. So you can see that those are the common generic types. And then it gives just examples for you going down the list. Again, moving to the specialty medications, Humira and Enbrel are well advertised, and several people do use Humira that I've spoken with, so you would know where those drug levels fall. I mentioned before, Humana's mail order pharmacy changed its name last year to Centerwell. The only reason we changed it is that they are actually independently marketing now pharmacy for people that may not have a Humana medical plan. So just rebranding it for that purpose alone. It's still owned by Humana, same Humana locations, et cetera, for any of you currently on the Humana plan. Nothing has changed with that. So for enrollment, I mentioned at the beginning, there is an application on the last page of the green Humana booklet that is outside. And if you do decide to maybe, think on it, maybe later on you think, well, maybe I should take a look at Humana, you can always just give us a call or call the school board office and they'll funnel your information, and we can have, as Trish mentioned, a concierge reach out to you and explain the plan of benefits to you and get materials out to you. So for enrollment, after you fill out the application, our informational booklet has an envelope, a return address envelope, and it's to the school board office. So you don't sign up directly with Humana. This is a plan that is sponsored by the school board. They need to know what plan you're choosing to be on first before they send the information over to us. So if you should decide to join the plan, you return that information to the school board office, and then they'll let us know what eligible date. We always start on the first of the month, and there are some cutoffs for them to terminate your current plan in order to get you on the new plan. So they just let us know when that first of the month is. And I'm staring at Ashley because she and I do actually communicate pretty much every day.
Does anybody need a book? Raise your hand if you need a book. You can pass it
While they're handing out books, I'm just going to, I'm thinking about enrollment, and it's not part of my presentation, but I am familiar with the policy and procedure at the school board office. They actually do allow folks to sign up for the Humana plan at any point in time, but then always we get the question next, well, what if I don't want to stay on the Humana plan? I hope that would never happen, because I know we've got a lot of satisfied members, not just here, but everywhere. I've been working at Humana for 18 years, and I wouldn't be here 18 years if I didn't really like what I'm talking about every day. But if you did decide you wanted to join the plan, and then for whatever reason you say, you know what, this is not for me, you can, during their annual open enrollment season, which is October and November each year, right?
Mid-September, mid-November. You can come back. She's getting ready to do that with January 1st. You can go back to the Blue Cross plan. You do have the opportunity, I'm going to say, to toggle back and forth, but you just can't enroll and then expect to leave the next month. You'd have to do so during our open enrollment period that we typically keep for our active members. So what
you're saying, I don't really have to change up. Keep Blue Shield, Blue Cross.
Yes, this is just an informational event tonight with regard to the two plans that LPSS has. They have the Blue Cross plan, which all of y'all are on it, and then we have the Humana offering. We get a lot of questions that people just don't realize that we have two plans. So we wanted to provide some informational events this year just to educate people. And whether you choose to move or you don't, makes no difference to us. I know that it makes a difference to Aaron and Humana, but really it's your choice is where it lands. And If you choose to move, then that's great, and then we can allow you to do so. It's just that you cannot go back to Blue Cross. Keep in mind, it's the LPSS Blue Cross plan. Until January 1st of the following year, you just contact us in the fall.
So I have a question.
Okay?
Would your premiums be the same if you went back to Blue Cross?
They would be whatever the board directed those premiums to be at the current time. Right now, those premiums have been the same for a couple of years. You just go back to the plan that you were currently on. Yeah. So let's just say you were under Medicare employee only, which is $92.70. You go back to that plan, or if the board increased the premium, it would be whatever the current premium was. Yes, ma'am.
So if the school board would happen to change from Blue Cross, which is no longer Blue Cross, won't be Blue Cross next year, if they change to another company, are y'all gonna put it out for bid?
That would be up to the board, but I would say, yes. I didn't want to
So,
go down that rabbit
well, if
hole
it is
for a
put out
second.
for bid, and say you accept, United Healthcare, if we prefer to go back to them, will we be allowed to next year?
That's a lot of ifs. I'll just make this statement, then I'll turn it back over to Ms. Aaron, and then I'm gonna give you an opportunity for some Q&As. But as we all know, you received other notification with regard to the Blue Cross plan and the acquisition with regard to Blue Cross. Right now, everybody was not even aware of that acquisition to include the Blue Cross employees or the consultant Hub International. So we're working through that process. It's all brand new. It's gonna take upwards of a year is what they're saying with regard to the acquisition. During that time period, we'll be in conversations with Hub International to have those conversations. And then should or if we're going to make any changes, it would go to the board through an RFP process. Does that help answer? So there's a lot of ifs. I don't even know all the answers to the ifs. I don't have a magic ball either, but yes, ma'am, it would land on the board's doorstep.
Okay.
But
I didn't know, so it won't be Blue Cross Blue Shield anymore? They're about to, not now, I know not now.
so I'm gonna take this last question, and I'm gonna turn it back to Ms. Aaron.
That's fine.
So Blue Cross of Blue Shield of Louisiana
Right.
was recently acquired. There was an acquisition, the 23rd, don't count me wrong on my date. It was Monday, I'd have to look at my calendar. We sent out communications to employees who are active members and retirees, and we basically got the notification about the same time you did when it was released to the media. We worked with our consultant for a couple days, and then they provided us with some additional information to which we sent out to active members and retirees. But yes, Blue Cross Blue Shield of Louisiana was acquired by Elevance Health, aka Anthem is what a lot of people know them by. So Anthem Blue Cross is who purchased Blue Cross Blue Shield of Louisiana. But I'm gonna step away, I'm gonna let Ms. Aaron finish her conversations. I'm thinking you may have some additional questions. I'll be happy to answer some general ones. And then you saw staff members when I introduced them, they all have blue shirts. We're all versed on a lot of your questions that you may be asking tonight. We can certainly help you with those, okay? I'm sorry.
Oh, no problem. Hey, I learn something new every day. I didn't even know Anthem bought Blue Cross. So moving back though to the Humana plan, and if you should decide to enroll, what happens after you enroll? Just like to let members know what they get and when they should expect to get it. First things first, as soon as we get your application from the school board office and we get you into our system, we send a letter to you confirming your enrollment. So that way you know that you're in the system. The next thing you're gonna get is your Humana member ID card. So typically that will come usually within a week to 2 weeks before your effective date. So, and a lot of people get antsy about that ID card. That's why I like to tell you, it's coming, but it's usually one to 2 weeks before your actual effective date. The next thing that you're gonna get after you're a new member is what we call our evidence of coverage. It is a very thick book, and you probably get something similar to that with Blue Cross. It's probably called a summary plan description, but the EOC goes into great detail about the benefits that are on your plan. In addition to that, a good third of the booklet is actually information from Medicare that we put into the book that they want to relay to their Medicare recipients. And because we are working on their behalf to process the claim, that's why you see a lot of the Medicare language in that book. After you become effective on the plan, we have and we offer what we call a health assessment. You would standardly get a postcard offering if you want to take a health assessment. It is completely up to you about whether or not you want to. We like to do the health assessment so that we can identify before we actually get a claim in-house if perhaps you've got a chronic condition that qualifies for one of our disease management programs, or let's say if you're in the midst of care as a new member, we want to get a care coordinator to help along the way to make sure that your transition is smooth into the Humana plan. And then finally, another point of education for our new members, we offer on this plan what we call an in-home wellness assessment. It is typically done by a physician assistant. They come in and it's offered to all of our members. We do target some members where when we've seen claims come in and we notice, I'm just going to give an example. If we see somebody that is on oxygen and receiving oxygen, but there's absolutely no diagnosis connected to the receipt of oxygen, we know that something probably either they're not going to the doctor like they should, or the doctor is not submitting the correct diagnoses, you know, that kind of thing. It's up to you whether or not you get an in-home wellness assessment. They also, the physician assistant will go through the extra benefits and services that I'm about to go through with you right now. For those of you that have smartphones, if you're on our plan, we do have what we call our My Humana app. You can download the app and you can look at all of your claims information, and there's also additional information like being able to look up your medications more easily. It's right there. And then there are a couple more things on My Humana that I'm going to talk about on another slide here. An additional benefit that we have on the plan is telehealth services. You can utilize, we use 2 different vendors for telehealth. We offer, and of course that's also $0 copay for you. You can see a primary care doctor through telehealth. You can have a specialist visit. You can even have an urgent care visit. And what I love the most about our telehealth services is that we offer mental health services. You do need to schedule an appointment through telehealth for mental health services, but we all just know that there is a shortage nationally of mental health providers, so this kind of helps give additional access when somebody needs it. Also, when the pandemic started, a lot of your doctors started doing telehealth services themselves. That's also covered. So if you're a primary care doctor, you call up and they say, you know what, we can just do this through a telehealth visit, that's covered on the plan. So I wanted to let you know that you don't have to use a Humana third-party vendor if your doctor does offer telehealth services. Couple things that I want to mention for anyone interested in our plan who happens to be diabetic. For anyone that may be using continuous glucose monitors and supplies, Humana does have a preferred vendor that we utilize for you to get your supplies, and that would be through either CCS Medical or Edwards Healthcare. Just alerting to you all to that in case you do use that. That you may need to change the provider that's currently supplying you those supplies. And then also related to diabetes, our diabetes testing supplies, we have preferred monitors for the diabetic testing, and you can get these free of charge. Even before you become a member, if we see that you're in the system, we can start to coordinate and get one of these meters sent out to you. Or after you become a new member, you can certainly go and get these new meters. A lot of folks, you've got enough supplies with maybe your current meter that you're using, and whenever you're ready to get that new supply, we can get a new meter out to you. But there are 2 AccuCheck meters and then a True Matrix Air. It's a Trivida meter. When considering a Medicare Advantage plan, and specifically this Humana plan, I'm going to go into some extra benefits and services that are offered on this Humana plan. They just come automatic with the plan. You don't join or pay extra for these benefits. And so when you do consider like a Blue Cross plan that's paying secondary to Medicare, you don't kind of have these bells and whistles with a Medicare secondary plan that you do with a Humana plan. So it's something that, you know, it's a great resource for members to have a lot of this information. And I'll start with our most popular extra benefit, which is our free Silver Sneakers membership. For any fitness center that offers Silver Sneakers classes, we will give you a free gym membership at that gym. And I think I looked up and I've got them all written down, but you know, Anytime Fitness, Snap Fitness, those are the 2 big name ones, but there are other ones around here too. I think in the greater area, I pulled up somewhere in the neighborhood of 26 different fitness centers. So you can join not just one. It doesn't matter to us. You can join every single one of those 26. We just really want our members to get out and be active, and it's just a great benefit to have. Now, also in addition, if you don't feel comfortable going to a gym, I mean, we do still have COVID around, even though we pretend like it's not around anymore. If you don't feel comfortable going to a fitness center, and please know that Silver Sneakers does have some options available to our members. A couple of them that I want to relay to you. One, you can go onto silversneakers.com after you are a member, and you can pull their exercise videos on demand. The second thing, if you don't belong to a gym, and this is an either or, you can't belong to a gym and get what I'm about to describe, but if you don't belong to a gym, you can connect with Silver Sneakers, and they can send you, it's what we call a equipment box based on your desires. So if you're interested in yoga, they will send you some yoga supplies in a box free of charge just for you to use at home. There are other kinds of services as well. I think they offer 6 different kinds of boxes for you to choose from depending upon your interest. Another extra benefit and service that sparks the interest of retirees when I talk to them is our Go 365 rewards program. It sparks their interest, but I will tell you, I look at the utilization of people redeeming their rewards cards, and it's so much lower than I know it should be. So if you join Humana, remember that you've got a rewards program that rewards you for the things that you're probably already doing anyway. First off, if you're going for your preventive care screenings with your primary care doctor, that is worth $25 in gift cards right off the bat per year. Other screenings that you may qualify for will also up the ante on these gift cards. For instance, and things can change each year, so for any of you that are current Humana members, things did change in our rewards program for 2023. So we have increased, we really want folks to go out and get their colonoscopy. We are now offering $50 in gift cards to get a colonoscopy this year. A lot of people are afraid, so we will even send you a free in-home test kit, and you can get up to $20 in gift cards by doing an in-home test. Just giving you examples because I want you to have question and answer. But you can earn up to $125 a year easily, not just for those preventive screenings, but also for exercising, if you do join one of those Silver Sneakers fitness centers, anytime you walk into the fitness center, it counts as a workout. You can go walk in and drink a cup of coffee and leave, but we count it as a workout. And if you don't belong to a Silver Sneakers fitness center, you can log your own fitness. You can log your own exercise. You can log your steps. We did increase the number of steps that we require our members to take this year. It was really low the past few years. You only had to walk 500 steps in a day. So now it's 5,000. So it didn't just go up a little bit, it went a lot. So you can log, if you 12 days out of the month, you log 5,000 steps, either onto your My Humana app, or if you don't like using the computer or apps, we can send you a paper kit and you can log it in yourself and send it back to Humana. You can get up to up to $60 a year for your physical fitness logging. Then my favorite part about Go365 Rewards is we reward our members for social activity as well as volunteer work. So if you belong to a club and you attend a meeting, you can log that you attended a meeting, and that's worth $5 in rewards. Any of you who are current members here and you came here tonight, you attended basically a retiree meeting and you would get a $5 reward. Here's the catcher of it all though. You have to be the one to choose your gift cards and redeem for your choice of gift cards. We've got over 20 different gift cards that you can choose from. You know, your standards like Walmart and Target, there are restaurants, there are gas cards like Shell, you know, so gives you the gist of the kind of gift cards that are available. But be sure that you log in to get your gift cards before the end of every calendar year, because it all goes away and then it starts over again. So as I mentioned, a minimum of $125. If you're due for some of those screenings, you can actually earn up to $225 a year in gift cards. Along with these other benefits and services, we do offer care management team, and I kind of already talked about our care managers, like in the transition to being a new member, what they're there for. They're there for disease management, they're there for case management, should you have a hospital stay, those kinds of things. They're just really there to help coordinate your care. One of the things that our care managers will offer you should you have a hospital stay, these are a couple of extra benefits should you have an inpatient stay. We do offer transportation up to 50 miles each way, 12 visits or 12 transportations, so that would be either 6 round trips, or if you're going for a follow-up visit after your hospitalization and someone's able to drop you off for a visit, but you need transportation to bring you back home, that's why we do it in one-way trips. You do have to utilize that service within 60 days of a discharge event, but that's usually when people are going for physical therapy and follow-up doctor visits, that kind of thing. Another item that we offer for anyone that's had an inpatient stay is a home health aide. And that's different than home health care from a medical covered standpoint. These are non-Medicare covered services, but they are covered on the Humana plan. So a home health aide, 4 hours times 2 visits after a hospital stay. So up to 8 hours of services, and what they do, they can help do grocery shopping for you if you can't get out. They can help prepare your meals. They do light housekeeping. And they also help with any activities of daily living if you need help getting around, need help bathing, that kind of thing. That is what they are there for. And then finally, on our after an inpatient stay, another offering that our care manager will offer is our Well Dine meal program. We'll send 28 meals to you after a hospital stay, should you desire them. Send it to your home. If you're not staying at your home, let's say you're staying with another loved one, we can have those meals mailed to your loved one's home. They will either come frozen or we can send them freeze-dried because not everybody has enough space in their freezer for 28 frozen meals, especially in Louisiana. I know. We've got 50 pounds of shrimp in my freezer, so. All right, My Directives is just an additional website that is offered to our members, something that none of us like to talk about, but we should think about, okay? Yes, ma'am. Sure.
You're in the hospital, they discharge you to finish continuing IV at home. But Medicare wouldn't pay for the supplies. So I had to go into the Blue Cross. So I
Right,
had
so
to pay
this
myself. Do y'all do?
We would cover any Medicare covered supply. So if Medicare was covering it,
They pay for the medicine, but I needed.
okay,
All
that's
of
a personal question, so
Okay.
we may need to answer that one-on-one or look it up for you. Yeah. Well, My Directives is actually just an additional website where you can put down what your wishes should be should you not be able to speak for yourself in an emergency situation. And if any of you have ever been in that situation with a loved one, boy, do I wish that my loved one would have had something like this. So again, we don't like to think about it, but it's just something where if you put down what your wishes are, if you aren't able to speak for yourself, your doctors will be able to pull that and be able to relay that information to make sure that your wishes are what you want that are done in the way that you would like them. I really think this might be my last slide. Thanks for your patience. Humana Health Coaching is, again, just another additional benefit. We talked about our care managers. Health coaching is available to you all to help you improve whatever it is that you may want to improve. If you want to stop smoking, we can get a health coach for you, and they can help give you guidance. They can help encourage you along the way. If you want to start a weight loss program, if you want to start to get active and you haven't been active, that's what health coaching is there for, and it's, again, all free of charge for you. Kind of already went through the health resources, so I am going to stop. The number on this screen is our general customer service number, and I didn't introduce my coworker, Kayla, who's been sitting patiently over there. Kayla works at Humana. She is an account concierge, someone that Trish mentioned. If you are interested in the plan, you may be talking to Kayla or one of her coworkers. Anyway, she is here also if for those personal questions that you might have. She and I will try to divide and conquer after the meeting. But I think I'm going to turn it back to you, Trish.
Do we have some general question and answers? Would you like for Ms. Aaron to try and answer for you? We do? Or we can take several of those if you'd like.
I have a question, like this is your man of plan, what it would cost me, if I would get rid of Blue Shield, Blue Cross?
So his question was with regard to the premiums. You got a packet right there, sir. It's in your packet. Your premium information is listed in the packet that you have in front of you. We tried to include just some general information in each one of those packets, but if it's employee only and you're retiree with A and B, it's going to be a $0 premium per month. You're just going to have to pay your Part B premium, which is around $165. Yes, ma'am.
Who sends the claim in? You have to claim to Medicare and then Humana?
No, because we are working on behalf of Medicare, you just show your Humana card when you go to the doctor, and they're going to send the claim directly to Humana, and we process the entire claim.
So they'll send it to Medicare and,
No, we are working on behalf of Medicare. We're processing the entire claim. Medicare, we don't just get premiums from the school board office to help pay your claims. We get paid by Medicare as well. So,
okay. So it's one claim, the office does it with the Humana card.
yes, ma'am.
So we wouldn't have the, like, for me, I have the Blue Cross and Medicare. I would just have this one card.
Yes, ma'am. So her question was, I wouldn't have the Blue Cross and the Medicare. I would just have this one card with Humana. So that's correct. So keep in mind, in order to go under the Humana plan, you would have to cancel your Blue Cross and then enroll in the LPSS, keyword LPSS Humana plan. Keep in mind that same concept that we talked about before, you can go back. We allow you to go back to Blue Cross. You can go back to Blue Cross, but you have to do so during our open enrollment period, which is mid-September to mid-November. You contact LPSS Insurance, and we help facilitate it for you. That way you can transition back to Blue Cross on January 1st. Yes, ma'am.
I'm not exactly understanding. You said you still have to pay for Part, I have Part A and B right now.
Yes, ma'am. Okay.
Okay, and the $49 for myself and my spouse, which it would be plus something you're saying?
Medicare.
Plus,
your Medicare.
So her question was, you're telling me I have to pay an additional cost with regard to Medicare. Every single person, you've typically earned your Medicare Part A based on your work history, so you shouldn't have a charge for it, is what typically happens. Otherwise, if you didn't earn Part A, then you do have a charge for Part A from Medicare. Medicare Part B, now they just lowered it, it's about $165, I think it's $164 and some change. So you do have to pay for your Medicare Part B. You pay that directly to Medicare, however you have it coming through, either through your Social Security check if you're obtaining Social Security, or perhaps you're paying them directly. But you're making that payment directly to Medicare. If you're on our Blue Cross right now, you're doing that right now too. You're paying whatever your premium is for Blue Cross through your pension, whatever you've elected. You mentioned you and a spouse, so perhaps you're paying the 207 rate is what I'm thinking. And then you're paying Medicare, both for you and your spouse, $165 each. So the same concept applies here. You still have to pay for your Part B, the $165, and then depending on which Humana premium you're under, if you're employee only, you're paying a zero premium for that. If you are employee plus spouse in your example, ma'am, that's $49. So $49 plus the $165 plus the $165 in your example.
okay, my next question is probably about Humana, because I have our vision right now.
I was just about to tell you. And
Does Humana cover vision?
We only cover, that's a great question.
yeah, and then,
We only cover Medicare covered vision and dental services. So when you were talking about going to get your teeth cleaned.
I have dental. Will we still be able to keep our dental? I pay it on my own, you know.
I'm gonna just try to repeat the questions, that way everyone can hear me. I typically talk pretty loud, and hopefully Mark can catch it on the video. But her question was, hey, does it include any voluntary benefits? Is basically what she's asking. Does it include dental or vision? It does not. It's still just like your Blue Cross. It includes your medical plus your prescription. Same thing with the Humana plan. Can you keep the plan information that you still have with LPSS? Yes, ma'am, you can. So if you're
My
under,
dental, I pay on my own, you know,
oh, through a set outside
Yes.
of LPSS?
right.
Okay, so yes, you can
But
still
my
keep that.
vision is through LPSS.
yeah.
All still doable. I'm gonna call it like Piccadilly.
But it will be,
You can stay
It
with your
will be
different
extra.
providers.
it will be extra, correct? Or is that the premium that I'll be paying, the $49 will include that?
No, again, the premiums are only your medical and your prescription. Doesn't include any, I'm gonna call them voluntary benefits. We're gonna say it doesn't include dental, doesn't include vision. If perhaps you have dental and vision from the school board, if you have our Superior Vision, or if you have our Aflac Dental,
Right.
you can still keep that. The Aflac Dental is either deducted through your pension or through an ACH through your bank account. Superior Vision, you're typically writing still a check to Superior Vision. They haven't quite caught up with doing it through ACH yet. But no, you can still keep those benefits that you already have with the school board under the voluntary, the dental and the vision. And this is mainly just your medical and your prescription that you're changing. Yes, ma'am.
Okay,
No, they do not, no. This plan mirrors the Blue Cross plan, which is just your medical and your prescriptions.
a single individual
Okay.
who is, on Medicare, then we won't pay any health premium? no health premium will be deducted from our check?
If you're
retirement
under the
check?
Humana plan, her question was, would I have a premium? If you're under the Humana, the LPSS Humana keyword, because we tried to mirror this plan from our current Blue Cross. It's got some extras like Ms. Erin mentioned. But if you're employee only under our plan and you're with Humana, then correct, the premium is zero. It's nothing. The school board, just like with your Blue Cross, you may not realize it, but they pay portions of your premium.
Right.
There's a general fund portion, there's a sales tax portion, there's a retiree portion for those retirees that are coming after you guys. So they do the same thing with your Humana premium too. And they pay a portion of your health insurance with them. So they're picking up the tab.
So we're not gonna have a portion to pay.
Exactly. If you're employee only, Medicare A and B, you're gonna pay Medicare, the 165 like we mentioned. And then your premium, you won't have a premium that deducts from your pension if you're under the Humana. Right now, if under Blue Cross, you'd be paying, if you're employee only, retiree only with Medicare A and B, it's $92.70.
Right.
Yes, ma'am.
Okay.
What about the doctor's list? Do you have a doctor's list as who we can go to?
We have on Humana.com, you can look at our provider list, but remember, this plan covers it 100%, whether you're using a Humana provider or not a Humana provider, as long as that doctor accepts Medicare and is willing to submit the bill to Humana. So it's less important to be looking at a doctor's list when you're talking about a plan like this. But we do have it available on the Humana.com.
Yes, ma'am.
She talked about you paid a pharmacy drug card. You paid up $2,500. She's talking about once you get that deductible of $2,500,
The maximum?
the max, yeah, that's what.
Yes, ma'am.
And then
Okay.
after that is 100% coverage.
I'm gonna let Miss Erin answer that one, make sure.
Yes, on the specialty medications, that tier 4, the most you will pay is $2,500 out of pocket for specialty medication.
So how does that done out of the pocket? You mean as it, I'm trying to understand that part because mine is high. I have pushed it, but anyway. 25 is as you go, you get the medicine, you pay a certain amount.
You're gonna pay 10% of the cost
That's
of the
what, okay,
medication.
that's what I'm trying to say.
10% of the cost of the medication up until you pay $2,500 out of pocket.
Okay.
Then coverage is at 100%.
And just one of my medicine would take care of it.
Now, that's just on the tier 4.
Okay, I
Your
have
tier
to,
1, 2, 3 copays,
Yeah.
you will always pay those copays.
oh, I'm glad you said that. Okay. So, you're talking about for drug card, but if you go to the doctor, you don't pay,
You don't pay anything.
Okay, but it's almost like default, like the way it's
Your tier 4 drugs are gonna be your most expensive one.
And that,
So they're
that's my main thing.
10%, and then Ms. Erin mentioned it's a $2,500 maximum under the tier 4. Correct me if I'm wrong. Okay. But the other ones, you're paying your co-pays based on the other tiers. The tier 1, 2, and 3, you're paying the co-pays.
So what happens to the Medicare card that you have? You just keep it,
Keep
don't
it in
use
your
it?
wallet because that
Yeah, 'cause
information goes
Medicare
under
funding.
your Humana.
Always
Right.
keep it handy, just when you
I
go to the
would.
doctor, don't present that card. Now, there was, we tell our members that all the time, and then when COVID came along, Medicare was paying, even for our Medicare Advantage plan members, Medicare was paying for the vaccine directly, so you did have to present your Medicare card, even on the Humana plan during that. So you always want to keep your Medicare card,
Yeah.
but when you go to the doctor, you just present your Humana card.
So
The
it
lady
all-
in the back's been raising her hand for 5 minutes. I'm sorry. How can I help you?
That's okay, it's more comment, and it's about the doctors.
Okay.
Number one, be sure when you're on Humana, that you say LPSS, Humana, Medicare Advantage. Don't ask a doctor if they take Humana, because nine
Very
times
good
out of 10,
point.
you get the wrong
Yeah.
answer.
Oh, yeah.
My husband and I have both been on it for, I guess, almost 10 years now, and we have paid zero premiums, zero doctors. That includes, he had a stent put in. He had rotator cuff surgery, he's had spinal issues. We can't say enough about it.
Thanks for sharing that.
I don't even know her. I did not.
But I'm glad you shared it.
I'm gonna introduce Mr. Roger O'Brien real quick, and then we're gonna take some more Q&As because I know you've had your hand up too, ma'am. So I'll just say, I've known Mr. O'Brien for, I've been with LPSS not quite 8 years. Okay, Mr. O'Brien came through when I was brand spanking new to LPSS. We've stayed connected and now we share stories about our children. I don't have grandchildren yet. I'm getting there. No, not getting there, but I'm getting older. I'm getting older. How about I say that? Oh goodness. I think I might have a panic attack. I have 2 children and we swap stories with regard to our children.
Yes, we keep up with each other's kids now.
But Mr. O'Brien has been under the Humana plan, and I wanted him to come tonight just to give you a personal account. How about I introduce him? He is a Lafayette High former retiree.
Yeah,
That is where you
25
retired
years,
from.
25 years in Lafayette High.
Okay, and then we'll go back to a few more Q&As. I just wanted to try and keep you guys on time so I can get you out of here, but I appreciate your time. So I'll turn it over to Mr. O'Brien real quick.
This little card is really all you need when you go to the doctor. I mean, that's it. You hand it to them, they run it through their little card reader, and after that, it's nothing. You don't really, is there a button you have to press?
I thought I did. I'm sorry, keep talking.
And you don't really have to do anything other than show this card. And in the 7 years that my wife and I have been on this, I've counted, and now I don't see them all the time, but I've got 8 personal doctors and they're all specialists, okay? Zero pay, copay. I mean, I was so surprised after I retired. It's like, Lord, if I'd known it was going to be this good, I'd have done it quicker. But, and she sees 5. And one thing about the vision part, and it wasn't said, but if you're seeing an MD, at least so far Humana has covered, if you're seeing like an ophthalmologist, and you have a chronic eye condition, it's covered. Now glasses, no, I don't know about that. As long as it's a specialist, it's going to be covered. And they're in office procedures, and even other things of that nature are covered. We've had the misfortune of having to go to the emergency room here at Lafayette General. It's now Ochsner's, and we absolutely did not have to pay 1 nickel, and that was just amazing to me. I mean, but it really is a good policy. I mean, I have a nurse practitioner that I see because I have a chronic condition that I was, as you said, we're not supposed to talk about. We've gone to the walk-in clinics when our regular specialist is not available, and no money down. Lab work covered, and we do. I mean, I see, have lab work done about 4 times a year, at an average, and that's covered. I had a back problem, and the doctor and all of the MRIs and everything else and the rehab covered, 0 copay. And that's after 7 years. So if, I can only tell you what our experience has been, and it's been good. We've not had any problems with it. In fact, the only problem that we did have was when I first got on, we were first with Humana. I do stutter occasionally, but it's all right. It's a lifelong thing. My name was still on the Blue Cross list, and it made it out to all the doctors and said it was primary. And I called Trish. The next thing I knew, I was getting a call from Humana. They assigned I don't know if I can say this word correctly, a concierge person. And that concierge person called every medical provider that was having a problem with billing.
Oh, that's
And they handled everything. All I had to do was to call them. The moment I got a bill that said, hey, what's going on with your insurance? I called them, they called that provider's office, and it was done.
It's on you.
It was done. It really was very easy, and that's the only problem that we've ever had with Humana. You know, we were Blue Cross for years and years and years, 25 years. And I don't talk them down, they're a good group, but I can only tell you what we've done with Humana, and it's been really good. Can I answer these questions?
Did you use any of the service, like you said, like healthcare, or someone come to your house to help?
Well, yes, and we've had the nurse practitioners, and they do occasionally hire retired doctors to come to your home. Yes, ma'am, and they will go over, they'll look at the site, you know, they'll see if there's any issues, you know, with your mobility, and if there's something going on in the home that you need to be aware of. They go over all of your medications. I just recently, well, last week, a nurse practitioner from the pharmacy called and went over every one of my medications. Every one. And we went through it and we talked about, okay, was there a certain interaction with this and what I needed to be aware of? So, I mean, yes, they do an awful lot. And as far as Centerwell Pharmacy, we've had no problems with them. Comes in the mail. In fact, one of my medications has to be packed in ice, and it is sent to me within 24 hours of shipment. 48 at the longest, as far as I can recall.
Now, is them that deliver, or is UPS that deliver it?
Oh, it can be, most of the time it's FedEx or UPS.
Okay.
Now, the regular mail order will come through the mail.
Okay.
Okay, I mean, if it's a, you know, your regular bills, yeah. And, okay, I'm 1,495 steps behind. I wish I'd have known that, because, well, you know, 500 steps a day is easy, and the first 8 days, you know, you do 500 steps, and that's $5. Another 8 days later, you do, you know, that was another $5, and so we now have to step up our game, although it's not that terribly hard.
So what, you get a device or something in order to know you walk that much?
I use a Fitbit,
Okay.
and the Fitbit keeps track of your steps.
Yeah, that's what I'm saying.
And it will download to your phone,
Okay.
and my smartphone is smarter than me, but it will then send it on to
Did you call it a Fitbit?
a Fitbit. Yes,
Yeah,
ma'am. This is the
Or we
version
can buy an
2.
inexpensive one
It's
on
an
Amazon.
inexpensive
You don't
one.
have to buy,
And-
they have some like 50
Actually,
Where do
I
you
call-
get that?
Well, actually, this one, I got on the Home Shopping Network for about the same price as I would have for a Charger 4, which we used before the time.
These points that you get, can you use them to buy prescriptions at the drugstores?
No, ma'am, I have not seen that. Now, well, my wife and I we've used the 365 a great deal in the last 7 years. In fact, we're averaging an average of about $250 a year per person given back to us in cash in those gift cards. They used to use the Amazon gift cards, and so we would collect them at the end, keep them to the end of the year, and that's where we did our Christmas shopping. But they don't do Amazon now, they're now doing Walmart. And so, we get we're getting a gift card, and they come in $10, $20, or $25 and $50, and, so that's where we're doing our shopping now.
Experience the sign, we do not accept Humana, and giving them the card, and they say, oh, well, we'll accept it now.
Most of the time, when we first got started, our biggest problem was not with Humana. It was the fact that so many doctors don't want to take Medicare, period. And that's where your problem will probably start. And that once you turn 65 and you're in that Medicare zone, They don't want to have to deal with the paperwork, and we were turned down a number of times. But here's the really good thing. I called the local Humana office here, and they started working on our behalf, telling us, okay, we know this doctor and what you're wanting to use it for. They are taking Humana people, and right now the group that you can go with the Lourdes group or you can go with the Ochsner's group, and from personal experience, we've not had anybody with the Ochsner's group turn us down, and we've not used the Lourdes group in, I don't know, maybe 5-6 years now.
Called my doctors and just asked them if they accepted it.
Yeah, and it does make a difference that this is the LPSS, because there's this 800 number. If you're having any question at all and you want to know something, why something is, or if this is going to be covered, the people on the 800 number, and this has happened to me more than once, are astonished that this policy is as good as it is, because they don't see it all the time. This is a really good policy.
It says PPO on your card.
Yes, it does. It certainly does.
One of the things I wanted to add about the doctor acceptance, if you should run into an issue like that, that is also something that our customer service or concierge unit, depending upon who you go through, anything that goes to the school board office goes immediately to the concierge unit. Our regular customer service line, they're also capable of making outreach to that provider, because a lot of times it's just education to that provider where they then get made aware of that, oh, this plan pays the same in and out of network. Oh, okay, we'll send the bill to Humana. That's usually the way it ends up. Unless, like you said, they're a doctor that does not accept Medicare, which, by the way, there's about 3%, based on the last I heard, 3% of all providers in Louisiana have pulled out of Medicare. So 97% still take Medicare. That's good on, just letting you know.
Well, it sure seemed like 7 years ago we must have hit all 3%, but
When you go into the office, I think you said it, you have to say LPSS.
Yeah.
Humana.
I have friends who said, oh, well, they wouldn't accept it if I had had Humana, because I asked them. There's 100 different Humana plans, and there's probably as many Humana Advantage plans. You need to say LPSS, Humana, Medicare Advantage. You need to tell them the whole
The
thing.
whole story, Medicare.
If you're gonna call and ask, because, and like she said, you may have to pursue it, because there's still a lot of people out there that don't understand.
So if they say no, then we call the little number.
Yeah.
My question is, we spend a lot of time out of state, specifically Arizona, and right now we have no problem. If we go to a doctor or, any kind of healthcare facility, is it gonna be the same thing with Humana?
We have sons in Washington and Oregon, and one of them in Seattle is now in Boise.
we have sons in Oregon and Idaho right now, in Boise. And I ran low on one of my medications. In fact, I was out when we were out there, and we were staying longer than we thought we would have to or even wanted to. And took it right to the CVS, and boom, it was done. It was not a problem.
Same thing with the doctors or urgent care?
Yes, so the question, in case y'all didn't hear back here, she wants to know, will this cover her? They travel quite a bit, a lot of times mostly to Arizona. Will the coverage be the same when they are spending time in Arizona? And the answer is yes. This is the same coverage nationwide. Sorry. Yes, ma'am.
There's a new business, it's a doctor's clinic, I think it's called Centerwell, and they take Humana, and it's on, what is that, South College? Is that part of Humana? I mean, I don't understand, it's the same name.
Yes, thanks for bringing that up. So we do not only own our own pharmacy, which is called Centerwell, But we have, starting last year, just started opening up clinics throughout the United States called CenterWell clinics. And it's kind of a newer kind of idea where a team of providers, if you choose a primary care doctor at a CenterWell clinic, a team of providers discusses your case or your health the morning before you actually go into the provider. So you've got a whole team of people working with you. There's usually a pharmacist that is in the CenterWell location. And in addition to that, our home health nurses are now CenterWell branded employees, and activities take place in those CenterWell. You may have heard of Humana neighborhood centers. We have one in Baton Rouge and we have one in New Orleans. We never had enough members here yet for a full-fledged one. We do have a light, what we call a neighborhood center light location out in Lake Charles. But the CenterWell locations are open to the members and have activities on a daily basis, so, and education programs. I'm going to start in the back because I've seen you have your hand raised quite a bit here.
Yeah, how you doing? Thank you for having this informational meeting today, and I'm seeing my friend there, Daphne. Before coming here, I was apprehensive about this because we've been with Blue Cross and been fairly successful. We had good experience with them. When I heard Daphne say, and I put a lot of value on Daphne's comments. If anybody's in your knows her, you know what I'm talking about. She does her homework, research, and all that. I'm still a little apprehensive. That's going to help me make a decision, but I think my premium's $180 a month, my wife and me. We're both retired school board employees. And it sounds a little, I'll use the word suspicious, that I would receive the same services from another company and not have to pay a penny in premium. Did I misunderstand something that was said today?
You did not miss the premium part. So the question is, he's a little leery. Why does he not have to pay a premium for the Humana plan when it seems like the coverage is the same on the Blue Cross plan? There's no secret here. You get nothing, you know. It's free for you, but this plan is not free. We charge a premium to the school board office. It just happens to be lower, I believe, than the Blue Cross, and that's why they don't pass along any portion of the premium to you. But
As well.
Medicare pays us as well. So we're getting paid directly by Medicare. So believe me, that's the reason. We're getting a premium from them and.
Accurate, then it seems to me that it would be a no-brainer. After having done some research and hearing what she said, it would be a no-brainer to make the move.
If I have to pick one thing, it's change. It's hard to do change.
Yeah.
You're taking that first step. When I have retirees, when we're trying to go through, your available options that you have available for you, 9 times out of 10, they're about the age of 65. They are getting ready for Medicare. They're getting ready to retire. It's a lot coming at them. And you're used to the Blue Cross plan, so you feel comfortable there. But it's like I tell new hires when we bring on the new hires. What works for you may not work for the person sitting next to you. You really just have to assess your medical and your prescription needs and pick the option that's best for you. Now I can put a name to a face. I'm going to ask Ms. Daphne to speak again in my May meeting because I know I've seen her. She is a proponent of Humana. She's been on it for quite some time, if I'm saying that correct.
Yes.
And it's change. Yeah. But Ms. Aaron was correct. The school board does pay those portions of your health insurance premium. The Blue Cross premium, you don't realize it, but it is much more expensive. So the share that the board and the general fund and the sales tax pay, that's why the employee or the retiree and their spouse have a portion, because it is more expensive. The rate that the LPSS pays on behalf of Humana is about $225, because that's the surviving spouse rate too.
Although I'll make my decision mostly based on what she said, I've never seen anything that compares the services provided Blue Cross versus Humana? You know, like a quick reference, so they're able to look at it quickly. Did anybody
I was
find
the
anything?
same way. I spoke with Erin on the phone, and I was the same way. I was like, okay, this sounds too good to be true. What's the catch?
Yeah.
And, you know, she explained to me that there is no catch. They are getting paid. We're just not having to pay. The school board's picking up our portion of it. So thank you to the school
Thank
board.
you.
I agree with Carl, I've had the exact same experience. They paid for everything, we paid for nothing.
I do want to address your comment, though, which just escaped me. Yes. The comparison, thank you. As licensed agents, we are not allowed to compare plans. So what we do is try to give you as much information as possible. And sorry that you've got to do your homework on both sides, but just like Trish said, in the end, it's going to be what you feel most comfortable with and which plan works best for you, making your own decision. We can just help answer your questions. As many as you can throw at us, we're here for you.
So with that said, I'm going to narrow it down to like 3 more questions. That way I know we're way past the time that I told you that the event would be. And then feel free, staff is here. We can take your name, point of contact information. They're everyone in the blue shirts. We can connect you with that Humana concierge to ask your personal questions. But I know I want to get you guys out the door, that way I don't hold everybody up. But let me take 3 more questions. Ma'am, I saw your hand first.
Okay, Blue Cross Blue Shield, once I called, I used to get through the mail for thyroid medication.
Okay.
And then I go through GoodRx now, and
I was
it's the
just about
cheapest
to
way.
ask
So,
that.
and they said, we do recommend the cheapest way for you. So it will still be the same. We can go
You
the cheapest
could.
way, or do we have to get it?
Correct me if I'm wrong.
Yeah, with the,
They don't have to
because
use the Humana for their prescription.
If you're not running it through your card, we don't know.
I'll give you
We
an
don't know what
example.
you're getting, but you cannot, we've got we don't have, but there are manufacturer discounts, and Medicare Advantage pharmacy plans do not coordinate with manufacturer discounts. So you would just pay your co-pays for tier 1, 2, 3, and your 10% for the tier 4. You cannot coordinate a manufacturer discount.
You talking about like the
I'll
good
make y'all
X
aware
and
of
stuff?
Like the GoodRx.com.
See, because I had to use it quite a few times because the insurance wouldn't pay for what I needed.
Well, I'll give you an example. For active members, I have the high deductible health plan. I have to use GoodRx.com sometimes too. It just happens that way. Our plan may cost that
And you can
prescription
ask,
maybe more.
you can ask your pharmacy to check, what's gonna cost me the least, my insurance or GoodRx?
Exactly.
They will
And
run
then
a
it just
charge
runs outside.
Okay, so you
so
can
we
still.
can.
Okay.
You still can, you just can't use it in conjunction like Ms. Aaron said. You can't present both your Blue Cross,
Oh,
not your
no.
Blue Cross,
Wait.
your Humana plus your GoodRx. You can't use them in conjunction.
Okay, well, that's what I'm doing now.
That you can use one or the other.
Yeah.
It would run outside of insurance. Okay,
Okay.
number 2. Yes, sir.
Do you have to be insulin dependent to use CGM? For to pay for it?
That is a great question and a technical one, and my friend Kayla out back probably knows the answer to it, so I'm gonna have to ask her. I'm thinking, yes, you do, but I need to double check.
What was the question?
She asked the question. I'm like,
Continuous glucose monitors, do you have to be insulin dependent diabetic in order for those to be covered, the continuous glucose ones? I believe the answer is yes, you do, but I wanna double check.
I'm going to introduce our board member, Dr. Shessel. He'd like to speak to y'all real quick.
Hey, whatever you guys want to do is completely fine with me. Whatever you want to do, whatever you think is the best thing to do. I mean, there are bankers and artists on the board. I just happen to be a pharmacist, so I actually care to know what's going on. But whatever you guys want to do, whatever plan you want to go with, they want to bid it out, don't bid it out, whatever y'all want to do, just notify the board members and we'll take care of it.
so you're a pharmacist?
Yes, ma'am.
Where, like?
Well, it was with Walmart, but now just the medicine and help out mom and pop, Apple.
Okay, but it's good to know.
Home, roofing and construction business. It's a lot less stressful. I still keep my license in case somebody needs help. But whatever you guys
Yeah,
want to do,
that's
y'all
what
just
I'm
let us know. Whatever's the best thing for y'all.
I'm gonna
Just
try.
nobody up there is an expert whatsoever.
Yeah, that's but it's
Well, I know I
wonderful.
kept you guys way past the point. I
that was
appreciate
very
you coming out
interesting.
tonight. Thank you so much. And I trust that you keep coming. Thank you.
How you doing?
And if you were on a normal